We are with Hospice Home Care, and I am Mekenzy.
I'm Morgan.
And I'm Pollyanna.
And November is National Hospice and Palliative Month, so we thought what a better way to celebrate than sharing some information with everybody about all the services that we provide.
So kind of to start us off today, we just need to go over what hospice truly is. Some people have misunderstandings of what our services look like, so could y'all explain a little bit about that?
Yeah, absolutely. So with our services, there are lots of hands that play in to providing services for any patient. So one of the big things is the RN case managers. These RNs come in and they do a little bit of whatever for families, whether it is med refills or disease progression education, or maybe it's just support or any of these things like that. The nurse will go in and provide all of these services. In addition to the nurse, we also have CNAs that go in and provide personal care tasks for these patients. It can be things like bathing, hair washing, changing bed linens, or anything of that nature. Pollyanna, you want to share a little information about our chaplain and our social worker?
Sure. A lot of people, when they hear hospice, there's a lot of fear, I think, and misconceptions associated with that. And what we like to do is tell our families when we visit with them all about the services and help them understand why we're there and why we're doing what we're doing. Our chaplains do offer spiritual support. That's a regular part of our disciplines that's offered to the families and the patients. Now, you know, some people have their own spiritual beliefs. We don't try to force any beliefs on anyone, but we offer an outlet for spiritual support when needed, and we respect all beliefs. So that's part of what we do. So that's as much for the family as for the patient. And then of course our social workers deal with anything and everything non-medical. And of course, you know, sometimes you don't know what an insurance policy means, or maybe you need some help, you're interested in getting a loved one in a nursing home. Our social workers can help with all of that. They deal with all the details so you don't have to.
Yeah, absolutely.
So how are these services paid for?
The hospice benefit is paid for pretty much by every type of insurance, which means Medicare, Medicaid, private policies, retirement benefits that some people have, managed care policies, pretty much everything that is built in. Most people that we treat never have to worry about a bill of any kind. So existing insurances pay for it. And of course, even if a patient doesn't have insurance, we're still going to treat them anyway.
That sounds great. Looks like there's lots of options for that. Another question we have is, how do patients qualify for these services?
Yeah, absolutely. So with hospice services, the general rule of thumb is if the patient's provider or specialist believes that this disease could take their life within 6 months, then that shows their hospice eligibility. Any patient who wants to inquire about services, even if they're not quite sure yet if they need, then they can reach out to us at any point in time, and one of us as the patient care reps can go out and do what we call a goals of care visit with them. We go out, we explain services, we answer lots of questions, we overcome any kind of objections that they may have, and make sure that they fully understand services. And if everyone's on board, then we will send our admission nurse out to go and do an evaluation and request records and make sure that they do meet criteria for hospice.